training in clinical and research aspects. In this kind of training, the trainees spend part of the time, it's usually 75% of their time they do clinical work, and 25% of the time they do research work. The training can be at any level. It can be at the level of a foundation doctor. It's called the academic foundation program. It can be at the core training level, and it can be at the level of higher specialty. One of the bonuses in this training pathway is that it's a run through training program, which means if you joined the training system as a core trainee in certain specialty, let's say endocrine, you become IMT1 academic clinical fellow in endocrinology. So you guarantee that you will complete your training till the end, till ST7, without the need for another application between the core training and the specialty training. Without this privilege, you normally will have to apply again for specialty training after you finish your core training. But if you've joined the academic training at the foundation level, there is no specialization in the foundation. So you will have again to apply either to medical core training or surgical core training. One of the very confusing points about the academic clinical training is something called clinical benchmarking. And the clinical bench, I will speak later in the lecture today about the benchmarking, but it's usually something needed for candidates without national training number. After the stage, you can apply to the academic clinical training at any stage. As we said, foundation, you can apply at the stage of CT1, CT2, CT3 or IMT3. IMT, and this year they did a new change. This year you can apply at the level of ST4 as well. And if you are going to apply to academic clinical training and you don't have a national training number, you have to apply at the same time to the clinical training, because you will have to attend the interview for the academic job, and then you will have to attend the interview for the clinical job, and you have to succeed in both interviews. If you succeeded in the academic interview and you failed the clinical interview, you will lose the job. During the academic clinical training, you will have each year £1,000 to spend on attending conferences and the courses every year. And as I said, you will have a contract with the university, so you will work in the hospital and you can be a university faculty at the same point. You can, based on your skills, you can join at the level of lecturer or researcher or research fellow, based on your experience and your skills. Is that clear so far? Does anyone have any questions? You can unmute yourself and ask the questions.
So, Dr. Amr, we will apply for the academic clinical training together with the ordinary training. Okay? Okay. So we
Yes,
apply for
yes,
both.
yeah. This is very important. If you didn't put the application for IMT and you get the ACF job and you succeeded in the ACF
Mm-hmm.
interview and
Mm-hmm.
you don't they will not be able to give you an appointment for the IMT interview. You have to pass the IMT
Yeah,
interview.
but I
So
thought that the process will all run through the ACF application.
no. But when you put the IMT application, you will have to choose that you are applying for clinical and academic job. You will find one of the choices saying, are you applying for only clinical or academic and the clinical? So you will have to choose the academic and the clinical option.
Okay, I got you. Thank you. Yeah,
Okay.
thank you.
Okay. During the during this training, the aim of this training is to give the candidate some time to prepare themselves to apply for a PhD. They expect the candidate by the end of the ACF job to take time out of program and apply for a PhD. However, candidates with a PhD can still apply for ACF jobs. It is not uh, it's not an exclusion, one of the exclusion criteria. You can still apply for ACF job if you showed the panel your interest in getting more experience in research. For example, if you did in the past you did observational studies or simple studies, you can tell the panel through your ACF post you aim to get experience with more advanced level of trials or higher level of research. But doing the PhD is not mandatory, so you can finish the ACF training and you decide that you don't want to pursue a PhD, and you by the end of the ACF post you will be switched automatically to the clinical pathway. So if you are, for example, you applied for academic clinical training in OB-GYN and you finished the post 3 years of ACF and then you felt that you cannot manage clinical with academic work, automatically they will put you back to the clinical OB-GYN training without the need for reapplication a second time. If you are if you wanted to apply for academic clinical job at the level of ST4, for example in endocrinology, and you don't have a training number in endocrinology, then you will still have to attend the academic interview and you still have to apply for the endocrinology interview at the same time. And you will need your core medical competences to be completed or signed off before applying for to the endocrinology interview. If you have a PhD, some people they are interested in academic clinical training and they already have a PhD. You can and they completed their core medical skills or core surgical skills, and they don't want to apply for ACF. There is another type of jobs called clinical lectural jobs. In the clinical lectural jobs, they are usually post PhD, and it is divided into two blocks. It's 50% of the time spent in the research, and the 50% of the time is spent in clinical work. This is called the clinical lecturership. It is a 4-year program, and it covers you until either you complete the 4 years or until you finish your CCT. Is everything clear? Any questions? If anyone has any questions, just unmute yourself because I cannot see the chat at the moment. Any questions? Okay, I will go on.
Hi. I have a question.
Hmm.
So, if we are applying for academic clinical training, so will it be for the
Okay.
same duration as a usual clinical training? Like for histopathology, it's 5 years. So, if I'm applying for academic clinical training, it will also be for the whole 5 years, or like it will be
Yeah.
okay.
No, it will be only for 3 years.
Okay, so after 3 years, I will need to reapply to clinical.
No. You won't have to reapply again. So after the 3 years, you will you have two choices. Either you ask for time out of program, you just you take like a holiday out of program to do a PhD,
Mhm.
or you they will switch you automatically. You don't have to apply again to the clinical training.
Mhm. And for instance, if you don't want to do a PhD, but we want to do a master's or something, so even then we have to take the time out. We can't do it like within the same time. We are like within the 2 or 3 years time for academically.
No, yeah, you can for they usually don't give you time to do masters.
Okay,
Uh,
it's not
but
okay.
you at any point in the UK, this known in the UK. At any point, you can apply for time out of program to do anything you want to do in your life. If you want time to do a master, that's fine. It will be accepted. I am not saying it's not accepted. It will be accepted, and you will just prolong your training for an extra year.
Hmm. Yes, got it.
Okay.
Okay, thank you.
Mm, no problem.
Dr. Amr, I have a question, please.
Mm, yeah.
If I'm holding a medical doctorate degree but in another specialty, does it
Mm.
count, or they will ask me to perform a PhD in the current specialty?
So it will count. It will support your position in the interview in the scoring, but it will not allow you to apply for a clinical lecturer in the new specialty.
Mhm.
In order to apply for a clinical lecturer job in the new specialty, you have to have the PhD in the same specialty.
Even if I have publications in the new specialty? Okay.
Yeah, yeah, yeah.